What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, July 11th, 2024. If you're new to my channel, or maybe you clicked onto this video because you're searching on YouTube to find out what's going on with COVID right now, as you, or maybe someone you know, has tested positive for COVID. Well, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and you need to know what's going on with each of these viruses. Viruses just don't happen in the wintertime. They happen in the summertime as well. There's COVID, which can be all year round. There's regular colds, that can be all year round. And then there's also tick-borne illnesses, mosquito-borne illnesses. There's a lot of different viruses out there. You need to know what's going on with these viruses. And you need a platform or a space where you can come and get a report on what's going on with them. That's what I do here at Data Report each and every day. We're pretty much just about 7 days a week. I don't want to say 365 days out of the year, but the most days of the year, here we are, doing pandemic updates. So if you're new here, subscribe down below, give this video a thumbs up, hit that notification bell, get this word out to more people by sharing this with anyone you know. Of course, leave your comments down below. All right, we have a very busy news and data-filled day today. I'll try my best to keep this under the typical 20-minute time frame, but we shall see. There are a lot of things to get through today, such as news, and then it's Thursday, which means we do get some updates from various different places. Starting off today, Italy is reporting that the COVID situation, 3,844 new cases in the last 7 days, values increasing for the 6th consecutive week, worst value since February. And when we take a look at this chart here, you can see here, things are really starting to increase faster and faster in Italy. Hopefully that's a signal that maybe in the coming weeks they will see a peaking of their cases relatively soon. Now taking a look at Portugal. Portugal is also heading for a new peak in COVID cases. It says, on average, due to new COVID-19 infections, 12 deaths and 400 new cases a day have been recorded in Portugal. These are the highest numbers in almost 2 years. So never mind with winter, never mind with last year, Portugal is reporting their highest levels in almost 2 years. Wow, that is just not good. Moving on to this now. Going over to my website, we do have 2 Canada notes today. Yes, 2. And reminder, anyone can become a member of my website, add a news story, or make a comment, whatever. It's free to do so. It's a message board format. All right, in Quebec, 518 deaths since the beginning of the year. Cases and hospitalizations are rising. This was posted by my moderator on my site, Steve. Summary, the province of Quebec is reporting that 12.9% of COVID-19 tests are returning positive, with cases and hospitalizations currently on the rise since April 2024. There are currently 671 hospitalizations with a COVID diagnosis. As of the end of June 2024, there have been 518 deaths associated with COVID since the beginning of the year, with 50 of those deaths in June. So, yes, COVID deaths are still happening, and based on the fact that the levels are rising right now, I would assume that the July number of deaths will probably be higher there in Quebec, just based on the number of hospitalizations. So, yes, it is still a thing up in Canada. And now this, speaking of Canada, there is a COVID-19 outbreak on the 18th floor of the Montreal General Hospital as Quebec and other jurisdictions see a rise in COVID infections. So, yep, it's back to COVID times once again up in Canada. And get this, the hospital has implemented a mandatory mask policy for everyone on that unit, and everyone on that floor is being monitored for symptoms. I mean, come on. Okay, they're putting a mask mandate on that floor. Why not just make it the whole hospital? I mean, really. So, workers, so someone who works there, they're only going to stay on that floor? Okay, well, I got to go down to the 17th floor now, or I got to go down to the cafeteria for lunch. Ooh, I can take my mask off now because I'm not on that floor anymore. It makes no sense. It should just be the entire hospital. All right, moving on. to this now. And this is in Scotland. Sick note, Scotland, as workers take 18 million days off for illness in a year. Yes, data suggests Scotland is one of the or they're saying sicky capitals of the UK, with millions of days lost in the past decade. So they are really having a lot of people reported to be sick. Analysis by personnel injury experts claims company.uk suggested Scotland recorded the highest number of sick days, 17.7 million, of any part of UK in 2022, an equivalent of the entire population taking over 3 days off work regardless of age or employment status. Wow, that amounted to every worker taking off 6.5 days. That's totally ridiculous. Hello. Are you not alarmed that something is going on here? I think someone needs to look into this and figure out what it is. I have a suspicion of what it is. Pretty sure you do as well. Does the term long COVID come to mind? Yeah, long COVID. That could be part of the reason. Just saying, we do know that a large number of COVID cases can lead to long COVID, and it is a thing. Of course, there's obviously other factors as well, but again, people still testing positive for COVID, people getting the flu, people getting all these different viruses. Maybe it's more of the reason why, such as clean air and masking, could help prevent some of this from happening. Just saying. More on the UK in a little bit, because today is Thursday. The UK does update on Thursdays. Now, I have to read you a headline of a study. We've seen other studies that have said different things, but it's a study that came out. I want to be fair. I want to include it. Studies suggest reinfections from the virus that causes COVID-19 likely have similar severity as original infection. And I have seen this go on both sides of the aisle in the past. Some say, oh, reinfection can be mild, blah, blah, blah. Other studies have said, well, each time you get infected, the chances of you being severely infected go up. But this particular study suggests reinfections from the virus that causes COVID-19 likely have similar severity as original infection. So if you've had, say, moderate symptoms, according to this study, your next case, you will likely have moderate symptoms once again. And there have been cases where some people get a case of COVID, they have X amount of symptoms, or they feel a certain way, and on their next case, yes, let's face it, this day and age, people have had multiple cases. Some have been lucky to avoid it. Some have only had one case. There's many people that have had several cases. And for some of those people, it is the exact same each time to get COVID. I have seen several people say this. All right, if you want to read the whole study, it will make it onto my archives on my site. I already did tweet it out, and you can go out and read the full study, because if we sat here during this video and did the full study, well, we wouldn't have time for all the other things that we have to talk about for today. All right, it is summertime, and it is the summer of 2024, which means the Summer Olympics are coming up relatively soon. Well, we may have some roadblocks down the line, and I've been thinking about this for a while. I don't think the Summer Olympics are going to go as expected. I think there's going to be people that fall ill. I think there's going to be some surprises. And we'll just have to wait and see what happens. But Abby Weitzel, who is a member of the U.S. Olympic swim team, who is supposed to go with the team to the Olympics, well, as of right now, she has tested positive for COVID after Olympic swim trials, and despite that, she is going to continue on to the Olympics and go with the team and travel to Paris. And it is saying that she is testing positive, but she has no symptoms and is, again, preparing to travel with the team. We'll have to see what happens. We have seen people in the past with no symptoms end up having problems down the line. And when I say people in the past, I am talking about athletes. And we'll also have to see what happens. Is she isolating right now before the travel? Don't know. So there's potential we could see more people get infected. And it would not surprise me if we see more cases pop up down the line. We're starting to see outbreaks of illness. I don't have this added for today's video, but we're also starting to see outbreaks of illness with the Tour de France. So that's starting to become an issue as well. And one of those, within that outbreak, one of those cases is a case of COVID. So illness, it's out there. All right, moving on to this. Dengue fever. Nearly 200 cases of dengue virus reported in New York and New Jersey. And this has been something that's been popping up around the country, and it's really starting to become a problem. Nearly 200 people have been infected with dengue in the states of New York and New Jersey so far this year. Mind you, it's only July 11th. According to data from the Centers for Disease Control, New York has reported 143 cases, and New Jersey has reported 41 cases. The disease is uncommon in the tri-state area, but is suddenly popping up by the dozen. And as we know, with climate change, with everything else that's going on with COVID and everything, we're seeing a lot of things that are not normally popping up that are starting to happen. And reminder, dengue fever. It's a virus that is caused by the warm weather with mosquitoes. It's been very hot this summer in the Northeast, so that is likely a contributing factor. Alrighty, moving on. Jay Weiland, who does make COVID forecasting, did do his recent update, and it says U.S. forecast into August. Infections are anticipated to rise into August from continued pressure from KP.2 and KP.3, and maybe slower to recede than last year's summer wave. Note, last NWSS data is for June 19th, a full 3 weeks ago. Yeah, CDC is behind on several things, and we can see here, if we take a look at this graphic, this chart here, we can see COVID cases, they are expected to rise right into August. So for the rest of July and into August. But if we look at the end of this, as we get deeper into August, we can see here there may be some sorts of a peaking. All right, reading on. The regional trends are a bit more complex, as we can see in the data until June 19th. West is already mid-wave, South starting their wave, Northeast, Midwest show little movement, and yeah, that is the case here in Pennsylvania, for sure. I mean, it's rising over in New Jersey, it's rising in New York State, clearly. You'll see New York State a little later, but here in Pennsylvania, we're not seeing a major rise yet, and I'm going to show you that today in Wastewater. It's just not showing up, but it is coming. At some point or another, it's coming to my state as well. It says the West is near peak already, but the Northeast, Midwest will not likely peak until mid to late August. And then he says, I feel it's still too early to know how the impact of KP.3.1.1, yet another variant, the strongest variant at the moment, will impact numbers in mid-August. Still only a large handful of detections by U.S. surgeons. And I have to think, if that was to start to take off and try to take over, that would probably delay the peaking a little bit. But we'll have to see. As of right now, he is expecting a peaking in mid-August. So that's good to know. And of course, mid to late August for places like the Midwest and Northeast, which are really much slower to get going on this wave. And that usually does happen in summer waves. The North does usually peak last when it comes to the summer waves. And as we all know, summer wave this year did start earlier. So we'll have to wait and see what happens. But again, interesting to see his forecast. All right, moving on to the UK now, which long ago used to be an indicator for the US. Not so much anymore. Some are saying now we follow Canada. I don't know, but it's what some people are saying. UK this week. Good news and bad news. I'll give you the good news first. The good news is cases, they're down this week. 2,761. That is down by 549 for a 16.6% decrease. Deaths this week, however, are up by 17.5%, increased by 25 to 168. I'm telling you, COVID deaths, they're still a thing. Healthcare this week, patients admitted, 2,797. We haven't had an update on that in a while. That is up by 61. And their positivity rate this week is 14.6%. We'll take a look at some of their charts tomorrow because, quite frankly, we still have a lot of things to get through, and I'm seeing we're already 14 minutes into this video. Taking a look at the national pollen map for today. 58% of the country is in low to medium status at this time, and we can see the worst pollen is in the Pacific Northwest. Taking a look at air qualities for today, you're going to continue to see Canada being bad. Wildfires are becoming an issue, and some of that smoke does filter its way down here into the U.S., and we can see here there are bad air qualities really for a lot of places. The East Coast is actually not bad today, but Chicago, Minnesota, South Dakota, North Dakota, portions of Texas, portions of Louisiana, portions of Arkansas, all bad. West Coast, Montana, Wyoming, Idaho, Utah, Nevada, California, all seeing bad air qualities today. Heat-related illnesses continue to increase across the majority of the regions in the United States at this time. Want to learn more about climate and what's going on with weather? I do have another place where I do that over on X. You can follow me at Climate Data Report, and you can also go follow me over on my other YouTube channel, which is Climate Data Report. Not sure if we'll get a video in today. We may get something in today or tomorrow. We'll see. Moving on to Philadelphia, and I have to update this. Philadelphia did see an increase in the number of EMS incidents. Actually, no. I think it's down for today. Yes, 853 EMS incidents have been reported for Wednesday. And doing a live look-in right now at what's going on in Montgomery County, Pennsylvania. Not as busy as yesterday. The humidity's down today, so this is a good thing. We can see total EMS calls right now is at 8, and Chester County has been a little bit slower today. Actually busier than when I looked before starting this video. Stroke, overdose, heart problem, syncope, sick person, abdominal pain, unresponsive person, seizures, and unknown nature. Taking a look at what is going on in Pennsylvania today, don't really have much to say about this. Pennsylvania is not seeing anywhere showing increases, and we're actually seeing some places such as Center County and down in Delaware County, which are actually seeing decreases for COVID at this time. You heard me correctly. Decreases for COVID at this time. Walgreens today, the national positivity rate is up by 3% for the week. It is 39.6% versus 36.5%. Taking a look here now at Wastewater Scan, and we do want to take a look at what's going on in the West Coast. I did tweet about this earlier, and we just want to take a look at COVID. Take a look at this. You can see they've been rising since May, right on up to about June 27th. Now you're starting to see something here. I'm actually a little optimistic about the West Coast. We may be starting to see signs of a peak and maybe even drop in the West Coast. Now, yes, there's one little update there that shows, hey, it may be rising once again. I'm convinced they may be starting to peak right now. And as we saw before, Jay Wyland, he was talking about it as well, how they may be set to peak relatively soon. You gotta hold out hope. Chicago, we will get to you tomorrow. Moving on now, I did want to show you something from the CDC. Here we go. The CDC latest variant is the KP.3 variant. That is the latest COVID variant that is in control. And at this time, it is at 24.5%. KP.2 is at 21.5%. LB.1 is at 10%. And you're not seeing that other, what was it, KP1.1 or something. You're not seeing that on here yet. So eventually that may pop up, and we'll have to keep an eye on that. Next week will be the next update from the CDC, and tomorrow will be the next update from some of the other CDC data. We'll take a look at other CDC data tomorrow. New Jersey, I don't know what's going on with you. If you saw my video yesterday, there were over 300 hospitalizations. Today, same number of hospitals, just 73 hospitalizations. Their data is just an utter mess right now. New York State, it is a Thursday. This is usually the day we see the highest case reported for many different reasons, including New York City, and yes, we're seeing that today. 2,203 new cases added. It is ahead of where they were last year at this time, but remember, this wave started earlier. Does that mean that they will get higher than any point of last summer? Not necessarily, but it's something we're going to have to continue to watch. And, well, if the Northeast didn't peak until mid to late August, well, then it would be possible that they do get higher than last summer's peak, which was 4,596 people tested. But remember, less people do test now, so we'll never know what the real number of cases is. Hospitalizations in New York State, and I do have to change this because I was looking around at this earlier. Hospitalizations in New York State today, 991 people in hospital and 90 people in the ICU. Hospitalizations down slightly, ICU number remained the same. Taking a look at what's going on in Washington State today, we do see that the number of people in the ICU has now reached 20 for COVID. That's up by 3. And COVID hospital admissions is down by 23%. And emergency department visits for COVID is down by 6%. Alrighty, folks, we went through a lot of stuff today. If you enjoyed this video, give it a thumbs up. If you want to see more content like this, subscribe down below, share this with anyone you know, and of course leave your comments down below, and don't forget to hit that notification bell. I will see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Thursday. Thanks for watching.